Fatigue is defined as physical or mental exhaustion that stops the person from being able to function normally. However, fatigue is more than feeling tired or drowsy. It feels like you cannot go on in your work and may be caused by inadequate sleep, long shifts, physical demands, or scheduling issues. And depending on survey that done by me, incorporated of 248 registered nurses working in KSA hospitals, 95% of nurses answered that their work makes them fatigued overall. 90% of them reported that fatigue had affected their nursing care. 92% agreed that fatigue causes a huge threat to patient and nurses' safety. 87% have considered changing department because of workload. 89% confirmed that fatigue has negative effect on their behavior. Last thing, which is the very most important one, 58% of nurses confessed that they made an accidental medical errors because they were tired. What are the causes of nurses' fatigue? There are many factors causes fatigue to the nurses. 1. Nurses working shift of 10 hours or longer are up to 2.5 times more likely than nurses working shorter shifts to experience fatigue and job dissatisfaction and can negatively affect patient care. 2. Advanced age. Those older than 50 years of age are more likely to become fatigued because they tend to have lighter and fragmented sleep, which can prevent them from receiving an effective full night's sleep. 3. Pregnancy. Pregnant women in the first trimester, hormonal changes are likely the cause of fatigue, and condition tend to return back in late pregnancy. 4. Lack of sleep due to home responsibilities, such as taking care of old-aged parents, children, sick or child with special needs can also lead to sleep deprivation and increased risk of fatigue. 5. Inadequate rest between shifts. Nurses who often return to work with less than 11 hours between shifts are at higher risks of severe fatigue and sleep disorders. 6. Understaffing is a big problem because it leads to malpracticing and poor patient care outcome. 7. If you have an infectious disease such as flu, please stay at home because working while sick is a serious health hazard for patients and other colleagues. How can we know that our colleague has an excessive fatigue? There are notable signs appear on the exhausted person, such as diminished memories, slowed reaction time, slowed information process, irritability, compromised problem solving, decreased concentration and judgment, and diminished motivation. What are the risks of fatigue? Medication errors is the first risk that induced by fatigue, leading to improper care that may threaten patient's life. Patients may contract healthcare acquired infection. Why? Because if the nurse is tired, she may not perform an appropriate hand hygiene. Many studies show that tiredness decreases the ability to keep emotions in check. So, fatigue can worsen the behavior and increase anger. The last risk is charting error, which can result in poor outcomes for patients, liability issues, physician in charge, and other nurses. Some industries have been investigating fatigue and its consequences on health, performance, and safety, and they compared it as alcohol intoxication. So, for you as a nurse, you have to learn more about the effect of fatigue and good sleep, as well as making it as a responsibility for you to interfere when you notice a colleague suffering from effect of fatigue, and to encourage yourself to do exercises to increase attention, such as climb stairs or go for a walk near to your department. In addition to maintain good sleep and try to sleep and wake up at the same time every day if possible, and try not to rely on medication to enhance sleep. Last thing, avoid caffeine for at least 5 hours before sleep. In the end, I hope that you enjoyed it and you learned something new. Thank you for watching.